Hi, I'm Dr. Anna Fielding, and it's a pleasure to be able to share with attendees at the Wellbeing and Heritage Conference the Sleeping Well project created by the University of Manchester and Salford Community Leisure's Ordsall Hall. In this presentation, I'll be telling you about the academic work underpinning the project, how our exploration of early modern sleep has evolved over the past year, and what our next steps are as we move into a new sleep project combining historical healthcare models with the 5 ways to well-being and creative health. First, a little bit about Ordsall Hall itself. The building has several parts: a medieval section housing personal chambers, a Tudor Great Hall, and a 17th century kitchen wing. The hall was home to the gentry Radcliffe family until after the Civil War. They left Ordsall in the 1660s, and the property went through several guises over the centuries until it came into local council ownership and is now run by Salford Community Leisure. We're very lucky that, apart from some Victorian changes to the south side of the Great Hall, Ordsall Hall largely remains as it was in the early modern period, complete with surviving painted schemes, the kitchen fireplace, a minstrel's gallery, plasterwork chambers and bedchambers. Ordsall Hall was therefore the perfect place for the University of Manchester's Professor Sasha Handley to explore early modern sleep based on her 2016 book Sleep in Early Modern England, a link to which is available on this slide. From this book came the current Wellcome Trust-funded project Sleeping Well in the Early Modern World, and again there's a link here to the project website. A team of academics working with Professor Handley look at how early modern people looked after their sleep in order to control their overall health. The team's research includes looking at the natural materials of sleep. For example, bedding stuffs such as straw, feathers, bulrush fluff, oat chaff, moss and wool flock. Work has also been done on medicinal sleep remedies and how plants and herbs were taken from the garden and surrounding landscape and turned into a whole range of sleep aids. These acted to control people's temperature, mood, digestion, offered pain relief, cleansed the nighttime air they breathed, and fought disruptive elements such as bedbugs, all in order to optimise sleep quality. Sleep advice could vary depending on many factors such as the time of year, and so research is also being conducted on how approaches would differ through the seasons. In this way, the surrounding natural landscape and climate was something people had to work with in their search for high quality sleep, but often something they had to work against in cases where sleeping conditions were too hot, damp or cold, affected by light levels, disrupted by foul airs, or involved pests. All this research is fed through to me as a Sleeping Well project officer based at Ordsall Hall, and I turn all of this fascinating research into hands-on workshops, activities and programmes designed for general visitors, adult learners, school groups and community groups. All these activities are aimed at translating the research into accessible content, testing early modern approaches to sleep, and discovering if we can learn from such approaches in our 21st century lives. Sleep is often overlooked, or certainly has been until fairly recently, with it only just being spoken of in the same terms as diet and exercise. Modern sleep advice has large areas of overlap with early modern sleep guidance, but the ways in which people understood both how sleep impacted the body and mind and how the natural world affected sleep were very different to our understandings today. Early modern health depended on the fine balance of the 4 humours: blood or the sanguine humour, choler or yellow bile, phlegm or the phlegmatic humour, and melancholy or black bile. Every person was believed to have their own specific complexion made up of these humours. In very simplistic terms, if you were hot-tempered, envious, and had red hair or red colouring, you would be thought of as choleric. Conversely, if you were laid back or lived at a slower pace, you would be phlegmatic. Good physical and mental health involved keeping your own humoral complexion in balance. Anything that could upset this would increase other humours in the body and tip you off kilter, causing ailments. The 6 non-naturals were lifestyle and environmental factors that could upset one's natural healthy humoral balance. Though our project focuses predominantly on sleep, the other 5 non-naturals could also impact on health and interfere with one's ability to sleep well. So the 6 non-naturals, these environmental factors and lifestyle factors, are sleep, food and drink, motion and rest, so exercise and relaxation, excretion and retention, so what goes in and out of your body, so what we put in and what we want to get rid of, air, and that would include scent, and passions of the mind, what we would think of as emotional health. So certain foods were believed to be good for sleep, such as lettuce, milk, roses, barley, violets, apples, almonds, cucumbers, nutmeg, valerian and onions. These foods were used to either cool the body's extremities or warm the stomach, aiding digestion, which in turn brought about sleep. The stomach was believed to operate like a cooking pot, and once you went to bed, the contents of this pot bubbled away, and then the goodness from the food evaporated, rose up to the brain, and there condensed, cooled, and refreshed the brain. This caused you to feel better when you awoke. Too much cold and moist food, phlegmatic food, would result in too many corrupt vapours rising up from the stomach, flooding the brain, disrupting your ability to sleep, and bringing bad dreams. This might be less dangerous in the summer because the climate was warm and dry. However, in the winter this was especially dangerous, and so sleep aids at this time of year would focus on hot, dry or choleric ingredients such as spices and wine to keep the stomach fired up in the cold. Another of the 6 non-naturals we focus on is rest and passions of the mind. Air, and more specifically scent, could affect one's mood, causing sleep through the inhalation of cooling scents such as rose, which interacted with the brain. We know now that often soporific smells encourage the brain to produce the sleep hormone melatonin. So while the theory is different, rose is known as a sleepy ingredient now, just as it was in the early modern period. Passions of the mind, or emotional health, could cause lack of sleep through not purging worries before bed, through the saying of prayers, or through chatting with family members as one wound down before bed. People often kept journals in the early modern period, and we can use these to see how people worried about various things, including lack of sleep. A journal or diary can be a way to set aside worries before bed, and is regularly seen as a useful sleep aid today. These are just some of the connections that we discuss with workshop participants as we recreate old recipes or do different craft activities. And there are clear similarities between early modern and contemporary sleep advice, which we explore during our sessions. Our workshops involve the use of historical sources such as medical texts, herbals, recipe books and journals, and together these sources give us a good picture of how controlling sleep featured in people's everyday lives. They also allow us to better understand how early modern people thought about sleep and its connections with the body, mind and environment. Through remaking medicinal and culinary recipes, participants can see how important sleep was and what people did about it. Through remaking, we can understand more thoroughly the theory behind the recipes and the techniques and natural ingredients used. To take this example on the right, the ingredients used are poplar buds, roses, vinegar and rose water. These would all act to cool down the body, particularly if the resulting mixture was placed on the temples. This would then concentrate the body's heat on the stomach, aiding digestion. The combination of a warm cooking pot stomach and a cool brain would effectively turn the body into a still, distilling the vapours rising up from consumed food, which would more easily condense at the brain, causing good restorative sleep. We do, however, need to recreate old recipes with caution, as closer investigation can reveal some ingredients we would definitely not advocate for today. So this particular mixture in this recipe book is a salve using poplar buds, poppy and belladonna or deadly nightshade, plus benzoin resin or storax, which is like a gummy tree resin. So poppies and belladonna in there are both something that we would definitely not use in a public workshop. So we do have to vary things slightly when we recreate them. However, we can see the theory at play here. So the overall qualities of poplar buds were thought to be cold and moist, according to Woodall's The Surgeon's Mate of 1617. And so we're cross-referencing with other sources to make sense of the recipes that we are looking at and recreating. Remedies and food recipes to try at home are available on our project website, and the link to them is here on the slide. An easy but effective recipe to try is a lettuce poultice. Lettuce has a similar chemical property to poppies, but it's safer to use. Lettuce is ground in a pestle and mortar to extract the milk or juice coming from the stems. Rosewater and milk are added, then the mixture is spread on a linen cloth and applied to the forehead. Having tried this recipe, the sensation is a cooling one, with no soporific scents being inhaled and the rose relieving any discomfort such as a headache. This recipe is taken from John Partridge's The Widow's Treasure of 1588. So our project takes inspiration from the past and develops interesting and fun workshops for the public to engage with. It allows a deeper dive into a less well-known area of history and a chance to engage with historical sources in practical ways. As well as remaking, we also use craft activities to help explain early modern theories such as sleep and scent, or sleep and the passions of the mind, using aromatherapy, embroidery and bookmaking, for example. Investigations into lighting technologies and different salves and pastes and balms used to either calm the body and mind before sleep or prevent pests have also been developed into engaging workshops where people can try their hand at something new. This brings us on to how we believe our work can fit nicely alongside the 5 ways to well-being. Together with our workshop participants, we're learning new things, connecting with others, taking notice of the natural world around us and the effect it has on us, and often getting outside into nature through our use of the gardens at Ordsall. Lots of things we make are taken home by participants to give to others, and our programme also involves content for Ordsall staff and volunteers. We hope shortly to be able to develop the give strand of the 5 ways to well-being through working alongside Salford's social prescribing and volunteer service. The reactions we've had so far to our project have been encouraging. There's a clear appetite for these sorts of engagement programmes, and participants often record how they've enjoyed learning, meeting new people, have felt calm during the session through remaking and craft, and made connections to their own lives and their well-being. Salford Community Leisure have recently employed a creative health lead, and we're working with her to develop a new project alongside Professor Handley at the University of Manchester and Salford Health Sector Services. This would incorporate the holistic early modern health model we've showcased in this presentation, alongside the 5 ways to well-being and the known benefits of creative health. Greater Manchester's Creative Health Strategy states that Greater Manchester has committed to becoming a creative health city region. This means that Greater Manchester will be the first city region in the world to realise the power of creativity, culture and heritage in addressing inequities and improving the health and well-being of its residents. Many of you will know about the momentum surrounding creative health and the role heritage can play in addressing well-being. Research is currently underway by the University of Manchester's Research Centre Creative Manchester and their Organisations of Hope project. Work is also being done by Manchester History's Festival around creative health, and there is the amazing work continually being done by the Culture, Heritage and Wellbeing Alliance alongside the All-Party Parliamentary Group for Arts, Health and Wellbeing and the National Centre for Creative Health. We are currently applying to the AHRC for funding so we can begin our project on early modern sleep care and creative health. This aim is to make a difference to wellbeing in Salford and diversify Ordsall Hall, making it a site for heritage and a community health hub. Poor sleep has been reported as impacting on local residents' well-being, and so our task will be to develop a range of workshops, programmes and resources to tackle this. We'll also create toolkits for Ordsall Hall staff and volunteers, our health sector partners and other heritage and health organisations who want to follow our model of best practice. We'll work with Living Well Salford, Wellbeing Matters Social Prescribing, Salford Health Improvement Team and Mind in Salford to develop creative health content for groups and individuals, embedding creative health at Ordsall Hall in a sustainable way. This isn't heritage that only looks to the past, but also to the present and future, through history and healthcare then and now. So thank you for listening. There are a range of links in this presentation that you might want to go back and explore. We hope to update everyone in due course on our project progress, and we'll be working to disseminate our ways of working and findings over the next few years. Do get in touch with us to share your thoughts, and we hope you have a good conference. Thank you.